From Washington, D.C., this is Middle East Focus.
Welcome to Middle East Focus. I'm Alistair Taylor, MEI's editorial director, and today we're going to be talking about the COVID-19 pandemic and its impact on the Middle East, 1 year on. The region's first case of the novel coronavirus was identified in the UAE at the end of January 2020, and it subsequently spread across the entire region and around the world, resulting in the imposition of strict public health measures and leading to a massive economic downturn. According to official figures, more than 10 million cases of COVID-19 and 170,000 plus deaths have now been reported across the Middle East and North Africa. There's a lot to discuss, and today's program will be divided into two segments with different guests. The first will focus on public health, and the second on the economy. In our first segment, we'll be speaking to Amira Roess about the public health impact of the pandemic and the lessons learned so far. Amira is an epidemiologist, a professor of global health and epidemiology at George Mason University's College of Health and Human Services, and a non-resident scholar at MEI. Amira, thank you very much for joining us, and welcome to the podcast.
Thank you for having me.
Amira, just over a year ago, on March 11th, 2020, the World Health Organization declared COVID-19 to be a global pandemic. Where do things stand in the Middle East and North Africa 1 year on, and how does it compare to other parts of the world?
So now that it's been 1 year, we are seeing that for the most part, countries in the Middle East have responded, like many others around the world, by improving testing and trying to communicate their case numbers and their statistics to their populace and to the rest of the world. But it's been a mixed bag, with some countries really underestimating or underreporting their cases and their numbers, and others seem to be reporting the numbers as they appear. And I think a few of the ministries of health have noted that they're really only able to provide the numbers of those who have tested positive, and they recognize that it might be an underestimate. And I think that's actually been a real improvement from what we may have seen 5-10 years ago with other infectious diseases.
The other major part of the equation, of course, is the issue of the vaccine rollout. Looking at things from a sort of macro view of the region, how is that campaign proceeding so far?
It's also been a bit of a mixed bag, with countries who have greater GDP able to roll out the vaccine in a more efficient way. They're able to get higher vaccine coverage. The UAE, for example, they have done a fairly good job here. Other countries in the Middle East that have either lower GDP or lower investment in health, they continue to really struggle with the rollout of the vaccine.
The pandemic is, of course, not happening in a vacuum. How does COVID-19 intersect or overlap with some of the other key public health challenges facing the region?
There are countries in the region that have had internal conflict and that have had really poor health infrastructure, or that have disparities between urban and rural areas, or between minorities, et cetera. And so you are seeing that COVID-19 has exacerbated some of those disparities. We've known for a while that in some parts of the Middle East, a lot more infection control is needed in the hospitals. We need better resources, especially in rural areas. We've known for a while that without adequate sanitation, access to water, electricity, especially in healthcare settings in rural areas, that if there would be an infectious disease outbreak, that it could really adversely affect the populations that are served by those clinics. And we're seeing that in this case. A lot of times we just don't have good statistics or figures on what may be happening in rural parts of the Middle East, especially in areas that have a lot of internal conflict. The other thing that we're seeing is in areas where there's a lot of internally displaced populations or refugee camps. Those populations have been really hard hit, both by the disease itself and also from the indirect consequences of COVID-19, whether they're economic, whether they're other health issues. That's been something that we knew was going to happen.
Amira, looking across the region, what to your mind have been the most significant or noteworthy successes and failures in dealing with the pandemic thus far?
The most significant successes have really been in the higher income countries where we've seen a pretty rapid scale up of the COVID-19 vaccination programs, as well as a pretty high uptake of the vaccine, you seem to see less vaccine hesitancy in parts of the Middle East than in other parts of the world, although that's not strict. It's not across the board for sure. We've also seen that there have been some really nice examples of countries working well together to share data, learn from each other's mistakes. And that's been noteworthy. There have been some continued failures, especially in regards to dealing with internally displaced and refugee populations. And unfortunately, I don't think that really could have been avoided because these vulnerable populations are typically facing the worst impacts of public health emergencies. And you see this not just in the Middle East, but across the world.
Following up on that, what lessons can be learned from this whole experience? What do you think the region should do to better prepare for the next pandemic?
So one of the other big failures in the region, as well as in a lot of the world, has been really poor public health surveillance infrastructure. You are seeing this across the world, and in the Middle East, it's a bit more pronounced. And in part, it's because there just has not been a culture of sharing data or information widely. And that's something that's really needed to address global pandemics. We really rely on countries to share their experiences and to share what their case numbers are, to share if they're seeing emerging infections. And if they're not doing that, then our whole global health security agenda, the international health regulations really start to fall apart. And so, that's been, I think, a real failure in parts of the Middle East. Now, going back to lessons that can be learned from this experience, really, some of the key lessons are around improving the public health surveillance systems and funding them for the long haul, or at least thinking through how do we support public health surveillance systems so that they collect timely information and that information is then shared extensively both within a country, within the region, and then with the rest of the world. The region really does need to go back to some of their earlier conversations around how to improve communication when it comes to health surveillance, human health surveillance, animal health surveillance information. And if we can see an improvement there, then that can really help us avoid future outbreaks and future regional or global pandemics. One thing that comes to mind is the lessons learned from dealing with the MERS coronavirus. And I think in parts of the Middle East, they've done a really nice job in training healthcare workers on how to deal with emerging infectious pathogens. And you can really see that in parts of the Gulf where the infrastructure that was set up to deal with MERS coronavirus was somewhat translated to deal with the COVID-19 pandemic. But again, you're seeing that in the parts of the region that are higher income than in the other parts.
Shifting gears to the role of the U.S. in all of this, in the so-called Quad Summit meeting on March 12th, President Joe Biden, along with his counterparts from India, Japan, and Australia, committed to working to boost vaccine manufacturing and delivering in Asia. I'm kind of curious as to your thoughts on how that translates over to the Middle East. What more do you think the U.S. can do to help countries secure access to vaccines and facilitate distribution?
Yeah, this has been a really challenging part of this pandemic. And again, it's something that we're able to foresee in that a lot of high income countries, lots of countries throughout the world were really prioritizing getting the vaccine over to their own citizens. And there was some talk about, working with allies, getting the vaccine over to various allies. I think a lot more does need to be done to do better the next time around. And for the COVID-19 vaccine campaign specifically, I think the U.S. really could think through what kinds of deals they might be able to broker between some of the larger vaccine manufacturers and then local manufacturers in the Middle East. There is some really promising discussions with supporting India to produce a large number of vaccines that will then be distributed to some lower income countries. And I think we need a lot more discussion, not just about this, but also how to do better with the distribution of pharmaceutical and other resources moving forward.
What would you like to see the Biden administration prioritize in terms of COVID-19 response and recovery and public health more broadly?
I think it's important that the current administration really starts to think through long-term investments in public health infrastructure and related infrastructure. It's really problematic when we have the direction of the support shifting from one administration to the next. This ends up really hampering the development of public health infrastructure and other kinds of infrastructure when individuals who are trying to implement an administration's priorities end up having to shift after spending a significant amount of time scaling up, and then by the time they're ready to implement, it's time for the next administration's priorities to come in. And I think in general, that model really does need to be looked at more carefully. What a lot of countries in the Middle East need is a more thoughtful and sustainable support moving forward.
Looking ahead, what are your biggest concerns at this point, and where do you think we'll be in, say, 6 or 12 months' time when it comes to dealing with the pandemic?
I think one of the biggest concerns I have is the vaccine distribution in many parts of the region. It still remains fairly weak, with maybe less than 2% of the population being vaccinated in some of the more populous countries in the Middle East. There's very limited data coming out from these countries in terms of vaccination databases. We're not really seeing a lot of detailed information here. And if we don't do better in terms of vaccinating a larger percentage of the population, it is likely that we will start to see really large COVID-19 outbreaks throughout the region, especially in light of the more transmissible strains, the UK variant, for example, that we know is circulating in most of the world right now. And so unless a very serious COVID-19 vaccine campaign is launched, it's likely that we're going to find ourselves facing really large outbreaks over the next 6 months. And the other real possibility, if we can't get the vaccine distributed widely, is that you'll start to see large numbers of deaths in older individuals again. And we've seen that in some parts of the Middle East. I don't see much in the way of serious plans to improve vaccination in the countries that really need it the most. And for example, Libya, Yemen, these countries might really need additional help with distributing the COVID-19 vaccine. And it's not clear what the impact of the UK variant might be in these populations, but we really want to avoid a situation where the COVID-19 virus takes a strong hold in the region and will just continue to transmit there because the large percentage of the population won't be vaccinated or won't have immunity. If that happens, then the Middle East might end up being a place where visitors, come and then get infected and then take it back to whichever country they came from. And those are all things that can be avoided if a vaccine campaign is really supported.
We'll have to leave things there for today, but thank you so much for joining us, Amira.
Thank you.
In the second segment of the program, I'll be speaking with Shahrokh Fardoust about the pandemic's myriad socio-economic impacts and the road to recovery. Shahrokh is a research professor at the Global Research Institute at the College of William & Mary and a non-resident scholar at MEI. Shahrokh, thank you very much for joining us today and welcome to the podcast.
It's my pleasure. Thank you for inviting me.
Shahrokh, last spring, countries around the world were hit by several huge simultaneous shocks, including the global pandemic itself, as well as a resulting massive economic downturn. Where do things stand 1 year on, and what does it mean for the Middle East?
Well, it's been actually very long and turbulent year for almost every country in the world. I think from the global point of view, the advanced economies have fared somewhat better than most developing countries because of their health sectors were better prepared, although there is a great deal of variation among the advanced economies. But also they've had the financial and fiscal wherewithal to take what the economists call counter-cyclical policy actions to reduce the negative impact of these adverse shocks which came through the pandemic, and then the impact of the pandemic on the global trade and commodity prices and financial markets, and then through these various links on the for the globalized economies on the economies themselves, but also the lockdown that took place in many countries at some took action right away and others waited somewhat longer than they should have, which actually made things much worse in terms of the spread of the virus. But the lockdown themselves, of course, it had a very negative effect on almost all sectors of economy, from manufacturing to services to hospitality sector to business sector and so forth. So we are now at a stage where number of advanced economies are beginning to recover from the depth of the recession. Leading among them is the United States. Regarding Middle East, now if we focus our attention on the impact of the COVID-19 pandemic as well as what's happening in the advanced economies, we see really a three sets of effects in three sets of countries. The effects which are dealing with the impact from that comes from the like oil prices, international trade, and so from outside. The effects that come from the effect of pandemic on the health system and domestically on their economies, and their policy responses, individual country policy responses. Within the Middle East, I would say the GCC countries, they are actually are positioned to do significantly better in 2021 than they did in 2020. Many of them, of course, had negative growth rates in 2020 as a result of the double shock of the pandemic and oil price reduction on their economies. But the recovery is going to be modest in these countries as they start, reducing their fiscal deficit and addressing their balance of payment issues and so forth. Fortunately for them, most of them have very high level of reserves, international reserves and so forth, which they were able to tap into. So we call it both fiscal and balance of payment buffers that would protect countries that are affected by shock. So GCC countries were also much more effective in responding to the virus. They immediately were able to respond through lockdowns and trying to contain the problem earlier than other countries in the region, and they have, I think, relatively much better health system. I think most analysts are cautiously optimistic about the future of the GCC countries. Of course, that also depends how much the oil price is going to recover as a result of the recovery in the global economy. But I mean, still inventories are very high, and the demand for petroleum is still well below 100 million barrels per day, which was just before the level reached just before the pandemic hit the world economy. So I would side with those analysts who would say that oil prices are going to recover, above the levels they are now, but they're not going to reach $100 a barrel that they had experienced in 2014 or so. So because There is a lot of excess capacity in terms of production. Inventories are still high and so forth. So I would say for the GCC countries, that's the situation. I think the second group are the smaller countries in the region that are dependent on aid they receive from the richer countries in the region, I would say, and the support that they receive from the rest of the region, and as well as international aid community, and that is like countries like Jordan and Lebanon and so forth. I think the situation there is, of course, not as positive as it is in the GCC countries. In Jordan, for example, the virus, of course, there has been a number of attempts to contain it, but still, as of last week, there was an increase in the number of cases there. Lebanon's situation, of course, is very much affected by the political instability within Lebanon, and I think the economy has been really in a free fall. I think by the end of 2021, the country will have seen almost more than a third of its GDP vanishing through the very deep recession and volatile situation that it's been in. The larger economies in the region are also interesting cases to consider. Egypt, for example, its economy has been relatively resilient. It is one of the very few countries in the world that actually did not experience a negative growth rate in 2020. Its growth rate slowed down, but to around 2 to 3%, but it was not negative, and I think it's partly due to some of the actions that have been taken prior to the pandemic in terms of major infrastructure or other type of investments that have maintained aggregate demand in the country. Of course, employment and poverty and so forth have been affected adversely because of the almost very substantial reduction in tourism in Egypt, as well as a reduction of the revenues from the Suez Canal because of world trade slowed down, and a substantial reduction in the remittances that Egyptian workers receive, working in the region and as well as overseas, because everyone's economy was affected. So the migrant workers were affected. Iran is the other large economy in the region. That country has also been very much adversely affected by the pandemic. And I think adding to that has been a very severe impact of the U.S. imposed sanctions on Iran after the U.S. withdrew from the JCPOA during the previous administration in the United States. And of course, then comes countries like Morocco and Tunisia, which were also adversely affected. But tourism has been substantially cut back for the entire region. And of course, both Morocco and Tunisia always benefited from a very vibrant tourist industry, just like Egypt, which has been affected. And of course, the continuing problems in Europe and the recession in Europe and wave after wave of the pandemic has affected travel from Europe to North Africa and the Middle East in general.
Thanks, Shahrokh. You've painted a very detailed picture of the state of the economy across the region. I'm kind of wondering, taking a step back to take in the big picture of it all, governments across the region have taken a variety of different economic measures over the past year to deal with the pandemic, to soften its impact. In your view, what have been the major successes and failures on that front? What's worked and what hasn't?
Two or three lessons come to mind. Of course, it's too early to draw lessons, but and these lessons are also kind of global. They're not just for the Middle East region. But one is that, having had a good health system in place to begin with makes a huge difference, and we can see that. The countries that had weak health system, they were not able to deal with the issue very quickly, and the size of the problems caused by the pandemic overwhelmed their health systems to a large extent. Second is having what we as economists call buffers or savings set aside in terms of having a sufficient fiscal space to be able to, when you're getting hit, your economy gets hit, your revenues fall. Well, if you want to, keep your budget balanced, you need to cut back on spending. If that spending is actually vital spending for its on health and education, anti-poverty programs, and so forth, then you're going to hurt yourself by cutting back on spending. And of course, there are things like paying your debt, servicing debt, interest payments, country's security, and civil service. You can't cut back these. They're fixed features of your public sector. So if you don't have that much room to maneuver, then you will not be able to deal with the after effects of the pandemic and other external shocks that come with it. So therefore, your recession is going to be much deeper than it could have been had you had some room, some buffers, some savings set aside for the rainy day. And of course, this has been demonstrated very clearly by the GCC countries. But I think regarding the pandemic, the state of health system is critical, and also how quickly the government acted. Those countries that acted immediately, in terms of closing borders, lockdown, requiring masking, and so forth, actually have been able to weather this crisis much better than those who vacillated, or debated the issue and so forth. And globally, China itself is the best example.
Shahrokh, as countries across the region roll out their vaccination campaigns and begin to chart a path forward on the public health front, what do you see as the biggest economic challenges on the road to recovery?
As from the global experience, different sectors of the economies are going to be affected differently. The hospitality sector, the tourism sector, and to a very large extent, the small and medium-sized enterprises, the informal sector, are going to be in a fairly deep recession for a while, until people are fully vaccinated, confidence returns, because no one, those people who can afford travel and so forth, will not travel, even within their own country, unless they're vaccinated and they know where they're going to be traveling is safe and so forth. So I think the issue is that one has to make sure that as the vaccination rolls out, first of all, it's universal, it covers everyone, it's not just targeting the upper income groups. Second, it has to be coupled with the strengthening of the social safety net. I mean, the way that the Biden administration, for example, is addressing the issue in the United States should be, something similar. Of course, not every country can afford such an extensive response, but something similar should be done, like retraining and conditional cash kind of programs that would provide sufficient amount of funds for people to stay above poverty until the economy gets going. So assistance as the inoculation of the vaccine spreads through the population, it has to be combined with other assistance in order to make sure that the economic recovery is even, and it affects all the income classes and not just the upper income classes.
Shahrokh, looking ahead, what are your expectations for the coming months? Where do you think we'll be in say, 6 or 12 months' time? And what are your biggest concerns at this point?
My sense is that I would be more optimistic again about the GCC countries, although they will continue facing issues because they are not living in isolation. They're living in a region that is volatile. It's much poorer than it was 10 years ago, and with much higher level of population than it had 10 years ago. And with number of conflicts still brewing within the region. I think I would be very concerned about the region as a whole, but the GCC countries having had the resources and acted earlier, and with the oil prices globally beginning to recover, I think I would be kind of guardedly optimistic about their outlook within the next 12 months. I think for the rest of the region, it very much varies across. I think for countries like Jordan and Lebanon and so forth. I think receiving financial assistance from the richer countries in the region, receiving financial assistance from international financial institutions such as the IMF and the World Bank. Um, Same thing for I think Tunisia and Morocco being able to deal with the recession until the tourism sector and the services sector begins to recover. They need assistance in that regard, even though they may be following reasonably good policies. But at the end of the day, if they don't generate sufficient revenues from economic activity, they will not be able to maintain public spending, to maintain assistance to the poor, to the needy, and provide health services and so forth. So some of the countries in the region would need attention in terms of debt forgiveness, or some measures to lower the impact of debt services, external debt that they face, so that they can continue spending their resources on their people as they begin to recover. I think Egypt, for example, is a country that does need to continue with economic reforms as it's facing very large fiscal deficits. Now, part of the reason is, of course, the tourism sector is stagnant, and also the revenues from the Suez and so forth. They have been much lower than before. But there will be some recovery. But the recovery in these things may come slower than expected. So a combination of economic reform supported by the international community, such as the World Bank and the IMF and so forth, would help Egypt to weather the storm, going forward. I think in the case of Iran, I think the Biden administration is trying to start a dialogue with the Iranian government, and I think there are also positive signals coming from Iran of the desire to go back to their agreement, the nuclear agreement that they had before the Trump administration withdrew from it. So once the sanctions are removed and Iran is able to export oil and other commodities and so forth products, I think their economy should begin to recover. But it would take a while. I mean, it would take probably more than 12 months for the economy to recover fully. I think the region as a whole is in dire need of changing its growth engine. The type of economic growth that the Middle East has been experiencing has been really based on the old model of growth by any means, and that growth is not sustainable fiscally or from a climate point of view, and it's not inclusive as inequality in many of the countries in the region has continued to rise. So we need a new growth engine that it will hire a lot more young people, and it will hire a lot more women, and it will take advantage of the new technologies that are there. I think Middle East is not different from any part of the world that is already experiencing that type of change. It just they need to make important political decisions on undertaking the necessary reforms. And of course, calm and tranquility within the region will help a lot, not only domestic investors, but also foreign investors. Foreign investors are always, they would go into in countries where they are situated in in a safe and sound neighborhoods. So I think there is going to be a win-win type of solution if the region also can reduce the tensions that it's currently facing.
We'll have to leave things there for today, but thank you so much for joining us on the program, Shahrokh.
Thank you so much.
And thank you as well to our audience for listening in and to our production team for their work on today's program. We will see all of you next week.
This has been a presentation of the Middle East Institute. To support MEI's programs and podcasts, please donate at www.mei.edu. Thank you for your support.